Hi, my name is Fran Mada. I'm an Admiral nurse at Dementia Oxfordshire, which is a service provided by Age UK Oxfordshire. I'm also a professional doctorate student, and today I'm here to discuss about children and young people in households where there are people with someone with a dementia or people with a dementia. And we're looking at ages from birth till 25. I just want you to reflect with me on this about children and young people. Have you ever considered that children and young people can be carers for someone with a dementia? We know that they are carers in other conditions. For other conditions, they are considered as carers. But for people with dementia, have you ever considered that? If you have, do these children and young people actually know that they are carers? Do the adults around them know that they are living with carers, young carers? Some of the definitions, just to ensure that we are clear of who we're talking about here. A young carer is someone under 18 who looks after a parent or another family member, and that's by Action for Children 2024. And then a young adult is defined as someone 16 with an upper age of 25. A carer's trust 2024, but you can see that there is 16, there's 18. So I would say anybody under 25 is who we are talking about here. Because the common denominator with all these people is that they all provide regular, ongoing, various aspects of care and emotional support to someone with a dementia. That's why we need to think about them today. And there are some facts that we cannot ignore or overlook when we're thinking about dementia in these young people. The care and support for people living dementia is primarily given by families in the community. And that means we can't choose who is in our household. They are there, and people can't stop having children because there's somebody with a dementia in their household. So the children will be there. The children can't move out because grandma has come to live here. They'll still be in there. They've got godparents. They still have to see their godparents. The neighbors' children will come and play. And that's also something we have to think about. People are also having children in later years. And we know a lot of other people that are in this same situation. For example, a lot of celebrities we know of, because they are talked about quite widely, not just to nitpick on them. And we know of them. And they have children while they're quite in their older years, for example, after 60, 70, and some maybe in their 90s. And we can name a few. And generally, the number of people with young onset dementia is increasing. The UK population of people living with dementia now in total includes over 70,000 people with young onset dementia. And this number tells us that we have a lot more younger people that are impacted on by dementia directly in their own households. So this is why we need to think about this topic and the importance of it. And just to give you an idea of someone you might know or might not have known about, having children in later years and also young onset dementia. So this is Bruce Willis, an actor, 69, is a father of 5 daughters, and the age ranges are between 10 and 35. So he's got the young adults, the adults who are over young adults, they are 35, 30 somethings, and then we've got 10, 12. And so this is something we should always think about. Could it be that at some point we're going to forget that there are 10-year-olds in this household? Because when we make a phone call, we talk to the 35-year-old? Could it be that we forget them when we visit? Because we tend to talk to adults because they give more information and we think that's reliable information that they're giving us. So we tend to talk to adults. Bruce Lewis, in case you didn't know, in 2023, his family shared that he has a frontotemporal lobe dementia. So the aim of this session today is to raise awareness that young carers exist in dementia care, to raise awareness regarding their needs, and to challenge us all as professionals and anyone that's supporting someone with dementia, that when we meet them, when we have conversations with them, when we are reviewing them, we ask the question, are there children or young people in your household or in your family or your neighbor, depending on what's going on at the time? But definitely, are there children and young people in your family? Could they be in university? Could they be in college? So I didn't see them around here. And also to challenge us all to think about, what do we do? We know they exist. We know there are young people and children in households living with dementia, and they're being impacted on by dementia. What do we do about it? What can we do about them? That's the next question. And I'm going to tell you a story of young dementia carers from a study that I carried out in March to May 2021. I did carry out interviews with the parents of these children, so I didn't talk to them directly. The data was collected through Zoom and phone, but that still gave a lot of insight into what goes on with children that are under 65 and in families living with dementia. For this study, these were children of people that were under 65 and living with dementia. And the question that I had asked was, what are the experiences of spouses of people with young onset dementia relating to transition from a hospital to a care home? And while we talked about their experiences, it became very clear they couldn't live out talking about their children, because their children had also been impacted on by dementia. And as we know, the family gets impacted by dementia as a whole, not just one person. One of the main themes that came out was becoming a parent to their own parent. And this was a statement given to me by Ellen. Ellen had 3 children, a daughter and 2 sons. The time that the husband got a diagnosis, the children were still very dependent on parents financially and everything. They were still living at home. The 2 boys were the older, so they were at a point of moving to university, and the girl was still at home. When we had this interview, the sons children were all over 25 by then. And this is what she said to me. The children need their dad more at that time. They need guidance more because they are growing as well. That's becoming adults themselves. But obviously they are then becoming the parent of their father, which is not really the way it should be. And I thought, yes, we always talk about teenagers, young adults needing their parents even more as they grow older. And that need guidance and need those to learn from their father in this situation. She also said that decisions are made with us, all of us together, the children and myself. And when I went on to find out further what sort of decisions it brought some light to me of things that I'd never thought about. These children were involved in deciding about their father's resuscitation status, that our father should not be resuscitated in the event of a cardiac arrest. They were involved in where he goes for care home placement. They'd gone around looking at 50 care homes and didn't find any that they really liked. Of the 50, they thought maybe 3 their father could fit in. And eventually just the one that he eventually went into. And I could sense the difficulties those children had gone through, walking into all those older adults' care homes, and they were looking at the people in the care home, the way the care home is, and maybe finding that our father is too young to fit in here. But at the same time, they also had to make that decision that he can't come home anymore. So that should have been very difficult for these children. The children, the 2 boys, had finished university and they were now in work. So as they were growing up, she said that they used to talk to each other and they would have discussions as a family. And the children would say when they qualified, when they finished their degrees, they were going to work in another part of the country. And they did so. They finished university and went off. But after a few months, they had to move back home because then he needed more support. They would take him out for activities, for religious activities, for social activities, support him with food and drink, for everything that was not available in the society, in the communities around them, because everything was geared for older people and everything was not age appropriate for him. It was not culturally appropriate for him, and it wasn't what he knew. So the children had to come back to facilitate that. Mary gave a narrative about the negative impact on personal relationships. And she did on a number of times tell me that her biggest challenge was because she had 3 boys at home and they were 12, 14, and 15 doing his GCSEs. These children would try to bring friends home. That didn't go very well with their dad, who had dementia and would get really distressed whenever new people came into the home, when the children made noise. So these children never had sleepovers. They never had friends over. They couldn't go to the friends' houses either because they had to support their dad at home. They were the other eyes for their mom when she was busy doing other things. When she went out to the hairdressers, for example, she gave that example herself. She went on to say if the boys had something different on schedule, and this was always when they they'd invited friends or thought maybe friends could come in, she would always think, should they really come? Because then he might attack them. Do they want to come and experience that? Do we want to experience that? And so she would always do her own risk assessment and tell her children they couldn't bring anybody home. In the end, she said she couldn't have friends herself either. So our life is very low key. It was very just us in. There was nobody else coming into that family except professionals who came to do assessments and reviews. I asked her what the relationship was like now that their father was in a home a year later. And this was the answer that broke my heart. The boys have got mixed feelings about him because they feel he ruined their lives. She then corrected herself and said the dementia ruined their lives. And I thought, as children, They didn't even see the dementia ruining their lives. They just saw their dad ruining their lives. And she said they found it really difficult to dissociate him from the behavior that he was showing towards them. And that was hard, even for her as an adult as well. And this, I thought, could the situation have been better for these children if professionals had just checked? Where are the children? What are they doing? How are they doing? Then I also talked to Maxwell, who sort of summed up what everybody else had talked about. Children supporting the person without the dementia, the parent without the dementia. He had a daughter who was now 23, and the symptoms in her mom had started way before she was 18. And her mom had been in care homes for the past 3 years, care homes and hospitals. And he said, my daughter is the one who is more likely to remind me that the situation Gillian is in is not going to improve. Gillian's condition is not going to improve. And I thought, as a child under 18, getting to understand that my mom is not going to improve, she's going to die, she's not going to improve, this is going to get worse, should have been really frightening for her, would have been painful for her. And at the same time, she was actually the one who was supporting him more and giving all the encouragement to do things, to go out, to have a life, to do something for himself, and so that he could feel better. And this sentiment was echoed by all the other parents as well, that if they didn't have the children, they were not sure what they would do. Here are some of the words that were used by these parents to describe the state of the children and how the children and the young people and how the professionals dealt with them. I heard from all of them that children were invisible as carers for their parent with dementia. Children were not recognized as carers, and one went on to say they were discriminated upon. And then Mary reflected and said, actually, what I realized was that there was no specialist support or lack of services and resources for the professionals themselves so that they could be able to support the children. Instead, professionals then avoided the children. And on another note, professionals do not listen to the children when they tried to reach out to them. So this is also about for Mary. Mary's children, those are the 12, 13, 14, and 15. She described that they would stay away, they would stay in their bedrooms whenever their father was at home. They would try and avoid him as much as they could. And when they knew that professionals were coming in to assess him, to review him, to attend to a safeguarding alert that's been raised, police turned up a few times. These children would follow the person out. When the person was out, probably out of the gate, then they would go and try and talk to them. But each time, they were not listened to. They were just told, we'll come back another time. We'll come back another time. Even if it was after safeguarding, they were still told, we'll come back another time. These children also went to A&E for different reasons, particularly the one who self-harmed, and he explained what was going on at home and why he had self-harmed. And still, nothing really changed, according to Mary. So the children were never listened to, she kept saying to me. These children and young people who had their future plans changed. And as dementia progressed, each one of them took on, at some point, the role of restraining their own parent, either to support them during personal care or so that they don't go out to the roads, or because they were going to attack somebody else, physically attack somebody else in the home, and so they were protecting each other. The responsibilities just kept on going on and on for these young people and children. They all supported the parent living with dementia with daily activities of daily living. They provided occupation, they provided socialization, they initiated all they could in order to distract their father and their parents and provide emotional support and everything that an adult does. And surely this is being a carer, I thought. And if anybody isn't convinced, this is being a carer. This is what carers go through. Some of the outcomes that were reported by the parents of these children and young adults were poor physical and or mental health or emotional outcomes, and these were all negative, such as self-harm, drug use, alcohol abuse, and all participants reported increased anxiety and levels of stress in their children, even though all were now adults, young adults. They were now young adults, and the parent with the dementia had actually moved out of the home. Poor relationships with the parent with dementia were reported by Mary especially. And with the extended families, Mary and Ellen's children did not have a communication with their extended family, the uncles, the sisters, the sister-in-laws, and all the relatives that they used to, the grandparents as well. Loneliness and isolation, lacking friendships in younger age, was reported to still be impacting on them, even now that they were young adults. And so the person with dementia was no longer at home. They still found it difficult to have friends and make friendships. The question I have is, what shall we do about the young people? The services in contact with young people caring for adults with dementia are very few and not in all areas. And that's a fact. That's something we can't ignore and we can't hide away and we can't hide away from. We know that more and more children and young people are living with grandparents with a dementia in the household. There's super diversity at the moment. Cultures that there are a lot of immigration means that there are a lot of more cultures that emphasize caring as only being done by family members. So we need to think about children and young people. People are having children in later years, which I've described earlier, and young onset dementia numbers are increasing. We need to have time to sit down and think. Children, think young people. What do we do about them? I shall repeat. I've got here some references that you might want to have a look at if you want to. And I also have contact details for myself and the organization I work for, Dementia Oxfordshire. Thank you so much for listening. And please take this assignment with you. Think about the children in the homeschools that you're visiting. Ask about the children. Are they young people in this family? Could they be in university? Could they be in college? Could they be at school? If you don't say any around. Thank you.